Hello everyone! Good morning, good afternoon, good evening! Saan man panig po kayo, ng daigdig naroon kayo. Welcome to the 92nd episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Maraming salamat po for being a part of our credible online community, and to all those who have just discovered us for the very first time today, welcome po at sana po marami po kayong matutunan sa webinar po natin today. The COVID-19 pandemic and the subsequent lockdowns have brought a lot of suffering as people had to stay indoors, isolate when exposed, and refrain from social activities. Marami po talagang naapektuhan pero none more in terms of the difficulties than our senior citizens. Mula pa po sa simula, the seniors were at highest risk for infection, hospitalization, and even death. So they're really a vulnerable group. And as a society that cares deeply for our aging and elderly population, extraordinary precautions have been taken to prevent our seniors from exposure to the virus. The risk of exposure has been a serious concern of our frontline healthcare workers who found it unbearable to think that they could bring or cause an infection sa parents po nila or grandparents sa tuwing uuwi po sila galing po sa hospital. So it has been a long time since we have allowed our seniors to go out and interact with others, and for many, it has been a lonely journey para po may mga silent sufferers kumbaga po, and the stress of being isolated and feeling helpless po during that point in time. So ngayon po na tayo po ay nandito na po sa alert level 1 na tinatawag, ang ating pong topic for today, pwede na po ba or is it safe for our senior citizens to go out? So if you want the latest science-based and evidence-based information from a panel of distinguished experts, please keep it right here. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you. We are seeing a little over 600 participants po sa ating Zoom webinar. Hopefully, mas madagdagan po ito. And as always, I get to share hosting duties po. And it's my pleasure and honor to introduce our adjunct faculty at the National Telehealth Center, also the Special Envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado.
Hi Raymond, good afternoon. Magandang hapon po sa inyong lahat. Really nice to see everyone's names coming up on the chat. So from all over the Philippines again, Raymond, and naku, did you say 92nd episode? Ano ba?
92 episodes.
92 episodes na tayo. Sige, so welcome po sa inyong lahat. We hope you're going to enjoy and learn a lot from the discussion today. Alam niyo yung mga senior natin dati-dati tuntua sila kasi kakain sila sa labas, may 20% discount. Tapos biglang 2 taon di sila makapunta sa mga restaurant, di ba? Yung sine, libre. Wala naman sine mapupuntahan. So tanong natin, safe na nga ba talaga? At saka ano dapat yung mga aalalahanin natin bilang mga anak or mga apo? How can we keep our seniors safe, no? So I think you're going to like our episode today. As always, we have the best speakers for you, and we'd like to thank our speakers in advance for giving us this time and this opportunity. So pag-usapan po natin yan kung safe na ang ating mga seniors. Sige Raymond, over to you.
Thank you, Dr. Susie. And for those who are joining us for the very first time for this webinar, meron po tayo laging hinahanda na tinatawag po natin Person on the Street interview video. It's developed by the team over TVUP. So ang katanungan po that we pose to our interviewees, sa tingin po ba ninyo, safe na lumabas ang mga senior citizens at bakit? Please watch this.
Ang senior, siguro sa palagay ko, hindi man nakapabaksin, hindi siguro safety. Pero sa ngayon siguro ang senior citizen nakabaksin na siguro, pwede na siguro lumabas. Pero hindi masyado.
So tingin ko naman safe na siya, bukod sa syempre 'di ba, wala nagaanong surge. Tingin ko rin maganda na hikayatin natin sila o pahintulutan natin silang lumabas kasi yung mga nakakasalamuhan naman nila sa bahay ay lumalabas din.
Yung mga senior na ibang senior na hindi pa vaccine, siguro mas limitahan pa natin. Pero yung mga vaccinated na talaga, pwede nang lumagpas sa ngayon.
Pabor ako sa paglabas ng mga elderly nowadays kasi kailangan din nila ng exercise, di ba?
If they're vaccinated and they're they're highly encouraged to be vaccinated naman po. I think they're safe Pero if yun nga po, if they have this, meron po silang problems with their lungs, yung mga respiratory problems po, ayun po, they need to consult sa doctor and they need to be more careful po kung saan sila pupunta, lalo na po if crowded places po yung mga pupuntahan po nila.
On the psychological and social side, maganda, it's a good idea na makalabas na sila since yung mga seniors nafe-feel nila that they need to be included sa community.
Po, sa Taguig po, kasama ko po yung lola ko. She's 90 years old na po and very strong naman po. So nagpa-vaccine po siya last year, I think mga June, July po, mga mid-year last year. Ayaw niya po lumabas. I'm newlywed nung Feb. So ayun, di ba last year, sobrang lala nung COVID talagang pwede mag-event kayo, the next time hindi pwede. So talagang totally ayaw talaga yan pumunta sa wedding ko. So nung nakita naman bumaba yung cases and nag-relax na nga yung mga LGUs, ayun, napapunta ko po siya on-site dun sa wedding ko, which is outdoor naman po.
Siguro this time, ipagkaloob na natin sa kanila yung ganoon, na kalayaang lumabas, kalayaang sumaya sa labas ng kanilang mga tahanan. So para, di ba, for their sanity rin.
Sa mga senior na hindi pa nagpapabakuna, para sa safety natin, siguro pwede na kayong lumabas at magpabaksin para kagaya namin, pwede na kaming lumabas at mag-enjoy. Kailangan natin magbabakuna para sa safety ng lahat. Hindi lang sa atin na nakabakuna na, pero para na rin sa inyo at sa mga anak natin.
Thank you very much. Thank you very much, TVUP. Teka, nawala ako. Yun. Thank you so much, TVUP, for that. It's always nice to hear from ordinary people. And thank you for all of those who agreed to be interviewed, no? Pasalamat din kami, maraming laging okay sa kanilang magpa-interview. So maraming salamat po sa inyo. And we of course we use these interviews to reflect, no, on ano bang iniisip ng pangkaraniwan tao. At kayo po bilang mga frontliners, parang mga pasyente nyo yan, di ba? Yan ang mga iniisip nila. So tutunguan po natin yan, no? Tutuntunin natin kung ano nga ba talaga ang dapat gawin para ligtas sa mga seniors natin. Maraming magagandang idea. Sabi ko nga, nakikinig ako, dapat hindi sa crowded na lugar. Diba? Tama, yung mga ganun, ano, tsaka kung meron silang sakit. So, mamaya pag-usapan pa natin yan. Pero ngayon, meron mo lang tayong announcement. We've got an announcement in relation to our 2nd year anniversary. Raymond, ano ba yan? 2 years na tayong magkakasama. Alam nyo ba, hindi pa kami nagkikita-kita. Yung nitong team na ito, we have not seen each other yet in person. But anyway, we have a 2nd year anniversary on April 9. And of course, we would like to dedicate that particular episode to our COVID-19 heroes. And we have a COVID-19 Heroes Memorial. We're still making a call for photographs for the name, date of birth, date of death, occupation of your loved ones or friends. Parang hindi ko, konti pa lang ang nagbibigay, no? So, isama natin kung meron po kayong mga larawan dyan, you have pictures that you'd like to share. Kasi we just want to remember, we don't want to forget the sacrifice that our frontliners have made. Some of them have given the ultimate sacrifice. No? So, ito po ay, before April 9, padala niyo po sa amin. At kailangan po 300 DPI, dots per inch. May natutunan akong bago, dots per inch. Yung po ang resolution, dapat high resolution po ang larawan natin. So, huwag niyo pong kalimutan, o kaya kung meron po kayong mga kaibigan, paalala niyo lang na this is our little way of putting this together. I think it's looking better now. Nasa alert level 1 na. Sana makahinga na tayo. Pero wag nating kakalimutan ang sakripisyo ng ating mga kapwa frontliners. Okay, over to you, Raymond.
Yes, thank you so much, Dr. Susie. So, yung Filipino medical frontliner po, nakita nyo na rin po sa mga balita, how they have been recognized as the best or one of the best po in the world, and just to be able for us to memorialize po ang kanilang selfless contributions in the fight against COVID-19. And to let everyone know, dito po sa ating webinar po for today and for our future webinars, I'm seeing that we have a little over 800 participants now, but we can accommodate up to a maximum of 3,000 participants in the Zoom. For those who are watching us in YouTube and Facebook, wag po kayong mag-alala. You can still join us and participate sa interaction. Pero mas okay po kung nandito po kayo sa Zoom para po mas ma-fully experience nyo po ang ating online community. For those who would want to put any questions already, please feel free to put them in the Q&A box and ilagay nyo rin po kung saan po kayo nanonood dun po sa ating chat box. For those who are asking, lalo po yung sa mga nagtatanong sa chat box, nagme-message po sa Messenger, our certificates of attendance will be given to those who have watched at least 50% of the webinar duration. So we have already completed up to webinar 90. Medyo tinatapos lang po namin yung pang webinar 91. At meron din po mga nagtatanong ba't hindi po sila nakatanggap. We will recheck again our records po and hopefully we could get back to you as soon as possible. We will also like to invite everyone, lalo na po yung tuwan-tuwa po sa pagsali sa ating fun quiz, pre-test po, no? Hindi lang po sa Zoom poll, pero pati na rin po sa mga nasa labas po ng Zoom, katulad YouTube and Facebook. If you go to www.menti.com and enter the code, when prompted, enter the code 30292389. That's 30292389 for you to be able to participate in our fun quiz. We will be utilizing our standard panel discussion format, and so we have our opening remark speaker, our set of speakers for the main presentation, the reactions, and then our Q&A session later on. If you are chosen and prompted po to maybe join us in the panel, if you want to ask your questions live, hopefully you'll be able to accommodate us dun po sa aming hiling. And without further ado, Dr. Susie will be introducing our opening remarks speaker.
Okay, thanks a lot. Thanks a lot, Raymond. Mukhang maraming natutuwa dun sa Mentimeter. Siguro sa anniversary, meron tayong mahabang guest. Okay, so our opening remark speaker is former chairman of the Department of Rehabilitation Medicine of the Philippine General Hospital, 3 times dean of the National Teachers Training College at UP Manila, and also part of the original group that set up the Institute of Aging at the National Institutes of Health. So matagal na siyang nandito sa subject area na to na aging, at kami po ay natutuwa na paunakan niya tayong lahat to open our webinar today. So I would like to welcome Dr. Jose Alvin Mojica. Dr. Alvin, welcome.
Magandang tanghali po sa lahat ng participants from Luzon, Visayas, and Mindanao. Buenos dias, buenas tardes, buenas noches sa lahat. Yesterday, I was pleasantly surprised when my UP Medicine classmate texted me from the USA and forwarded the event poster and said she was attending today's seminar. I suddenly realized and said, wow, we have local and international participants nga pala. So wherever you are at this time, it is a great pleasure for me to welcome you to this virtual webinar series on Stop COVID Deaths that the University of the Philippines System has been organizing and hosting every Friday since April 2020. This webinar is part of our contribution to address the healthcare challenges brought about by COVID-19 and to support Philippine society in a time of crisis. As a frontliner myself and a senior citizen as well, I felt so guilty when I contracted COVID-19 after doing hospital rounds, then infecting my wife and children, even when I was wearing a PPE. Fortunately, all of us had only mild to moderate symptoms that did not require hospitalization, but still, all of us were isolated and felt depressed for some time. On the other hand, our younger colleagues have also been having a lot of anxiety that they could cause infection to their children, siblings, parents, or grandparents. Indeed, it has been a long time since we have allowed our seniors to go out and interact with others. To be honest, I have not visited my elderly relatives, godparents, and close friends for more than 2 years. Pa-text na lang muna, Facebook or Yahoo Messenger. A common question we ask each other is, ano maganda sa Netflix ngayon? As for me, I watch the travel videos on YouTube and dream of going to several destinations pag wala ng COVID. I would also like to take this opportunity to say again my condolences, because one of the earliest victims of this COVID-19 was my classmate, Dr. Kiko Lukban, who's a cardiologist, and he succumbed early on during the crisis. While our Department of Health announced that more than 60 million Filipinos have been fully vaccinated, only a small percentage of senior citizens have been fully vaccinated, and a much lesser percentage have received booster shots. Compounding this problem is a recent study that showed that COVID-19 antibodies in the elderly decline after 3 to 4 months, even among those who have received a booster shot. Plus, there appears to be a new variant threatening us again and might come over sooner or later. So the question that we ask is, now that we have moved into alert level 1, is it safe for our seniors to go out? In today's episode of Stop COVID Deaths, we will discuss the status of seniors, the vaccination levels, the condition of seniors that make it difficult for them to be vaccinated, and how we can weigh the risks and benefits of going out. Safe na nga ba talaga lumabas ang mga senior citizens? Well, I encourage all the participants to make today's webinar a lively, interactive, and enjoyable learning activity by joining the Q&A session either through the chat box or after the talk of our esteemed speaker, Dr. Shelley de la Vega, and the equally esteemed reactors, Dr. Nina Gloriani and Dr. Ed Poblete. I wish you well and God bless everyone.
Okay, thank you very much, Dr. Alvin Mojica, and we are looking forward to having you in the panel later. Maganda yung
Yes.
ating discussion
Thank you.
mamaya. Sige, thank you very much. Over to you, Raymond.
Thank you, Sir Alvin. It's not always that we can get Dr. Mojica. So maraming salamat, Sir Alvin po. We will now be, where do we go? So we will now go po sa ating 2 questions for our Mentimeter. So ulitin ko lang po, no, before we go to the questions, we encourage everyone to type in your questions po. If you already have any questions, please feel free to put them in the Q&A or in the comment section po ng YouTube and Facebook po. Para lang po, we will be able to scan and pick and choose which questions will be posed to our panelists. For the first question for our pre-test, ang una pong katanungan, isa lang po ang kasagutan. Ilang porsyento ng mga senior ang nabakunahan na? Is it 84%? 74% or 64%. So habang nagta-type in po, medyo konti pa lang po ang sumasali sa ating Zoom poll at saka sa ating Mentimeter. Batiin ko lang po ang mga nanonood from Wesleyan University, Philippines, Cabanatuan City, Nueva Ecija, from Abra State Institute of Sciences and Technology in Bangued, Abra, from the Senate of the Philippines. Hello po, DSW Haven for the Elderly, Tanay Rizal. Maraming salamat po. Lubang District Hospital in Occidental Mindoro and Capiz Doctors Hospital in Roa City, as well as J.R. Borja General Hospital in Cagayan de Oro in Misamis Oriental. Para po sa ating pangalawang katanungan, okay. Ano ang ibig sabihin ng term na healthy aging? So iisa lang din po ang tamang sagot po rito. Ito po ba ay walang kahit na anong sakit o kapansanan? Option 2, kaya pang gawin ang mahalaga sa kanila? Or option 3, pang senior citizens lang ito? So we will not be closing our Zoom poll as we greet our international attendees or participants from Chonin Hospital in Taipei, Taiwan, Bangkok, Thailand, Ho Chi Minh, Vietnam, Bukit Mertajam in Malaysia, University of Hail, Saudi Arabia, Lunichi Ali, University of Lida in Algeria, the UP International Health Nursing and Healthcare Forum in Lexington, Virginia, those from Manila, from Stockton, California, and those from Edmonton, Alberta, Canada, as well as St. Eustatius Auxiliary Home Foundation from the Netherlands, Antilles. So maraming salamat po. Alam ko po medyo iba-iba po ang ating time slot, kumbaga, sa kung nasan po kaya, but we are really very appreciative of you taking out the time to join us for our webinar. We will now move on to our webinar proper, and Dr. Susie will introduce our very first presenter.
Okay, thank you very much, Raymond. Parang nagtatagal sila doon sa unang tanong kasi puro fore, di ba? Ano yan? ano, 64,
84, 74, 64.
64. Okay. So sabi ko, parang walang sumasagot. Nag-iisip talaga sila. O maganda yun para maalala natin kung anong tamang sagot. No?
Correct, correct.
Alright. So we are very pleased to present our first panelist, and you know her and you love her. We've always had her here. Siya po ay, ano po ito siguro sabihin natin pioneer sa area ng geriatrics o ang pag-alaga po ng mga mas nakakaedad. And she set up the Institute for Aging at the National Institutes of Health. And she really loves seniors and understands them very well. So napakahusay po na Dr. Harvard trained ito si Shelley de la Vega. Classmate ko po yan. Sige, I'd like to welcome Shelley de la Vega, Director of the Institute of Aging of the National Institutes of Health. Shelley, take the floor.
Hello, thank you for that kind introduction, Doc Susie, classmates, Sir Raymond, Director Raymond, and of course, Dr. Alvin Mojica for that wonderful opening remarks. Let me now share my screen so we can start our discussion on that question. Pwede na nga ba lumabas ang mga senior citizens? Nako. All right. Am I okay?
Okay na, Shell. Okay na.
Okay, thank you very much. So let's try to answer this question. You know, you presented some videos of people around, no? And I also had a poll of my high school classmates. Sabi ko, ano, takot ba kayo lumabas? And you know, more of them are still afraid, even if they have been fully vaccinated, because they know that many of the citizens in the Philippines have not yet been vaccinated. So yun ang kinakatakutan nila kahit na nabakunahan na sila. So let's try to answer this question. We are now aware of the devastating consequences of COVID-19 on people with multiple comorbidities and advanced age. Most deaths from COVID occurred and are still occurring among older people, as seen in these numbers from our World in Data and Epimetrics. In the recent DOH COVID tracker dated 16 March 2022, it shows that although most cases reported are among young adults, most deaths still occur in the older age group, beginning at age 50, with the highest deaths among those 80 years and older. So let's talk about age and the risks of COVID-19 complications. Why is it happening? Before COVID started, we did the Fit for Frail study of 355 older people in 4 barangays representing the 4 regions in the Philippines, which revealed these comorbidities known to be associated with a higher complication rate and deaths from COVID-19. 55.6% had hypertension, 16.8% had diabetes, 15.4% were obese, and 11.6%, mostly men, smoked tobacco. Other risk factors that increase their vulnerability are living alone or being socially isolated and being dependent on others or needing a caregiver. Frailty, something that we associate always with older people, is that photo of an old person using a cane bent over or using a wheelchair. So that is really a frail older person. Now, frailty is defined as reduced strength and physiological malfunctioning that predisposes an older person to increased dependency, vulnerability, and death. The frailest are at risk of COVID complications, hospitalizations, and death. And in the Fit for Frail study, we noted that only 15% were frail. And especially those among age 80 years and older. In fact, 44.2% in the oldest age group had a caregiver, no, and were already dependent on others. However, in that study, a great majority were not frail. 19.3% were robust, and 60.5% were pre-frail. Dementia is a general term for loss of memory, language, problem solving, and other thinking abilities that are severe enough to interfere with daily life. In the Fit for Frail study, our geriatricians adjudicated the diagnosis, and it revealed that after undergoing the Montreal Cognitive Test and a comprehensive geriatric assessment, 24.4% of our participants had some form of cognitive impairment. and 9.1% had dementia, of which 3.2% were of the Alzheimer's type. Now, people with dementia are at a higher risk of COVID complications because of the following reasons. They have difficulty understanding the risk of leaving the house. They have difficulty following minimum public health standards, such as washing their hands and using a mask. Isolation increases their behavioral and psychological symptoms. They become more confused and agitated. In fact, kahit tayo walang dementia, kuminsan we feel that our memory is somehow more muddled during COVID isolation, di ba? All the more if you have dementia. COVID patients with dementia are prone to acute worsening of confusion called delirium. And studies by neurologists all over the country and in the world have marked this increased risk of delirium in hospitalized COVID patients. They are fearful, but are unable to express their fear. And there are communication barriers that makes it difficult for them to report symptoms or seek timely help. Now, as of 27 February this year, the IATF guidelines on the nationwide implementation of alert level system for COVID-19 response defines alert level 1 to be referring to areas wherein case transmission is low and decreasing. Total bed utilization rate is also lower, and intensive care unit utilization rate is low. So let's remember it as this. No? Let's assume that because we are at alert level 1, transmission is low and decreasing, and there is low utilization rate of hospital beds and ICUs. Okay. So alert level 1 also requires the prevention of COVID transmission, which includes for health facilities, administrative and engineering controls, including infection control practices. Communities are required to support mental and psychosocial needs, especially of the vulnerable groups, and make available context-specific and localized health and safety education materials. DOH and healthcare providers need to set up a mechanism for provision of care and referral for patients with symptoms or other emergency health conditions. So let's assume that these are all in place, no? So aside from these minimum public health standards, administrative and engineering controls, vaccine coverage also needs to be at least 70%, okay? However, in my opinion, we also need to provide a supportive environment that supports healthy aging. After all, we are in that decade of healthy aging, di ba? Until 2030. And assure that our senior citizens are healthy in body, mind, and spirit. So how do we go beyond COVID and approach and achieve healthy aging? Now, let's first define healthy aging. Healthy aging is the process of developing and maintaining the functional ability that enables well-being in older age. It takes on a life course perspective. We accumulate strengths and deficits across the life course. And functional ability is that ability to be able to do what is meaningful to you. So yun ang sagot dun sa ating question na una. It stems from the interactions between our intrinsic capacity, or partly from biological aging, and environmental factors, including a supportive healthcare system. Now, function and our intrinsic capacity are best when we are young. No? Ang taas niya dito sa graph na ito. But this steadily declines as we age. Acute illnesses such as COVID-19 can result in a rapid decline in functioning. However, if we have a supportive environment, that decline in functioning may be avoided, and functional ability can be extended and even maintained despite intrinsic aging. So that is what I want you to understand about the longitudinal perspective and trajectory of functioning and functional ability in healthy aging. So let's talk about cases kasi there, hindi naman magkakapareho ang mga elderly eh. Aging is an extremely variable experience. So when you say, can senior citizens go out during level 1? There are various kinds of senior citizens. Like I said earlier, there are the frail, the pre-frail, and the robust. So let's talk about Mr. Uylangco. Imbento ko lang yung pangalan niya. Siyempre, hindi yan ang totoong pangalan niya. Let's call him Mr. U. But he represents patient that I have encountered in my geriatric clinic. So Mr. Yu is 95 years old and suffers from Parkinson's disease and needs assistance in all his activities of daily living, such as feeding, bathing, dressing, and toileting. He has been confined to his wheelchair in his home since the pandemic began. However, despite Parkinson's disease, he remains mentally alert and enjoys activities such as watching TV and talking to his grandchildren online. He lives with his daughter, who now asks you if she can bring her father outside now that it is level 1. He has not been vaccinated because his daughter is afraid that he may get COVID from someone in the vaccination center. So, should Mr. Yu be allowed to leave the house to get vaccinated? Let's think about that question. And let us now proceed to healthy body, COVID prevention through vaccination. The answer, of course, to case 1 is yes. Mr. Yu is frail, but will benefit from vaccination and booster. His dutiful daughter needs to arrange a home visit vaccination through their barangay health emergency response team or senior citizen coordinator, and after his vaccination, provide tender loving care and make sure that his needs are addressed. In case he has some problems with pain in the vaccine site or some problems with the vaccine, if ever, no? But let's look at the health system and vaccine coverage based on the recent statement from WHO Philippines. They say that we need to achieve the minimum vaccination coverage target of 70% to protect those most vulnerable to COVID and its complications. However, 2.4 million senior citizens have not yet received a single dose of vaccine. Vaccinating the vulnerable, which includes the elderly, is an absolute priority. And in order to improve vaccine coverage, they say that we need barangay level, house to house, and close to home vaccination drives. And that is what we have been promoting for many, many months now. No? Okay. So, in the Fit for Frail study, we found out that before the pandemic, 54.1% of older Filipinos were never vaccinated against routine flu and pneumonia vaccines. It is good to know, however, that most of these vaccines were available and administered in government hospitals and RHUs. In that policy brief of ours, we recommended that we need to develop educational materials on vaccination for older people, close monitoring and follow-up of their immunization status, and to amend RA 9994 to expand vaccination to all older people aged 60 years and above, and to improve access to these vaccines to LGUs, health centers, and private institutions. Now let's go to the second case, Mrs. Gomez. Okay. Mrs. Gomez, or Mrs. G, is an 81-year-old owner of a carinderia. She's obese and has fairly controlled diabetes and hypertension. In general, medyo controlled. Sometimes napapadami ng kain, kaya tumataas ang sugar and blood pressure. She had her 2 doses of COVID vaccine and 1 booster shot. Now that it is level 1, she plans to attend her usual social gatherings, especially to get back to being actively serving in her carinderia customers, and resume her church and volunteer activities. So the question is it safe for Mrs. G to go out and resume her pre-pandemic work and volunteer activities? Okay. So, very optimistic ako. And the answer to case 2 is yes. Despite her medical condition and age, our fully vaccinated Mrs. G is robust. She is considered robust, no? And may resume her work in her carinderia, provided she uses a face mask, washes her hands frequently, and provides good ventilation in her work area. She also needs to follow up with her primary care provider or specialists, if she has a specialist, to ensure that her medical conditions are better managed and controlled. She may do this medical consultation through teleconsultation or go to clinics now for face-to-face encounters with her physicians. So let's now look at COVID-19 risks and vulnerabilities, again, based on that study that we did among older persons. No? There are COVID risks and vulnerabilities that I mentioned a while ago among older persons, and there are multiple opportunities to create a supportive environment, especially improve the health system. We need geriatric programs and services to enable the health system to achieve healthy aging and respond better to challenges of older persons during disasters and this pandemic and after this pandemic. So our recommendation in this policy brief is to promote healthy aging programs, such as the National Health and Wellness Program for senior citizens, which includes a comprehensive geriatric assessment, fitness, nutrition, and vaccination programs, and align the delivery of these services of health facilities and through regional health units with universal health care. So let's align this with universal health care. Now, fortunately, the good news is that DOH recently launched the Health and Wellness Program for Senior Citizens Manual of Operations for local implementers, as well as a geriatric training for primary health service providing training of trainers module. So nagtatrain na, getting ready na ang DOH. Both include sections on dealing with COVID-19 and they both give emphasis to universal health care. So we have something to really look forward to. Now, let's look at digital connectivity. Di ba, sabi ko kanina, our patients can connect with their doctors now through telemedicine. Now, we did a study called UPM-WISE at the start, called UPM-WISE in Diliman and Los Baños. These are former employees and retiring, hindi pa naman retired, but retiring faculty and employees of UP Diliman and Los Baños. And we found out that cell phones are the most commonly used gadgets for social networking, email, and obtaining information regarding work. In Los Baños in particular, 94% used their cell phones, 58% had a laptop, and 37% had a desktop. At the start of the pandemic, and while we were rolling out the vaccines, we realized that most senior citizens had no medical records, di ba? In the barangay health centers. And many had difficulty getting a medical clearance from a physician kasi hindi naman sila nagpapakita. Ako nagpakita man, wala man silang record na madaling i-transmit through cellphone, Viber, or whatever, di ba? Kasi nga, we were in lockdown. So Mrs. G, like many older persons, is adept in using her cell phone. And we can easily train her and many senior citizens on how to use digital means of accessing healthcare and health information. Okay, now DOH has been very active in producing health and safety education materials online. And these are accessible to many who are able to use websites, and these, if you can see, feature senior citizens. Unfortunately, not all senior citizens have access to cell phones or laptops, and wala silang pang-load. Furthermore, we need to look at the health information system for older persons. In that same study, we found out that there are health information issues that need to be addressed. In a publication by Garcia de la Vega and Dr. Mercado here, we found out that medical records exist for most, but were not digitized for many. There was no comprehensive geriatric assessment, and there was no individual EMR for older people. And at the moment, health information systems for older persons is fragmented, come from multiple sources, and is inaccessible in general. So hindi natin siya magamit, di ba? Sayang nung pandemic when we were wanting to list them down for vaccination and get them into the system. Wala palang ganong sistema. So let's now move into a third case. Mrs. Joaquin, Mrs. J, is an 81-year-old widow who has recently become more forgetful and confused, especially during the lockdown. She never had tests for dementia. Before the pandemic, she was advised by her doctor to get a CT scan of her brain and a 2D echocardiogram, because she also had some problems with getting short of breath. She is now fully vaccinated and boosted, but her children want to know, is it safe for her, Mrs. Joaquin, to go out to a hospital to get these tests done? Okay, let's answer that question. Let's talk about the healthy mind or mental health during level 1 and during the COVID pandemic. The answer, of course, is yes. She is fully vaccinated and boosted. And she is pre-frail. No? Mrs. J is a classic example of a pre-frail older person. And we want her to get optimal care. And she may safely go to a hospital to get her tests done despite her memory loss and confusion. Most hospitals now adhere to and have administrative and engineering requirements to reduce COVID transmission within their premises. She needs to be accompanied, however, by a responsible adult who will remind her to keep her mask on and to wipe her hands with a sanitizer as often as possible, or if even better, to wash her hands before and after encounters in the hospital. Now, we looked at the mental health needs of senior citizens in that Fit for Frail study. And mental health data from our study revealed that none of our participants reported having been previously diagnosed with dementia. However, after that cognitive test, as I mentioned earlier, 9.1% had dementia diagnosis. Now, many of our participants reported mental health symptoms such as memory loss, depression, anxiety. In that same study, 11 out of 16 RHUs were found to provide free counseling and psychosocial services to older persons. So meron naman pala. However, there were only 37 psychologists in the 27 hospitals that our team visited. And there are only now 160 certified geriatricians all over the country. We'll hear from Dr. Ed Poblete. Nadagdagan naman na siguro. Okay, so what does this mean to us and mental health? Now, we realized through scientific evidence recently that we now have a convergence. There is now a convergence between COVID risk reduction and dementia prevention. About related pala yan. We can reduce neuropathological damage and reduce COVID risks through four common things. Through minimizing diabetes, treating hypertension, smoking cessation, and reducing midlife obesity. If we do this pala and help our patients achieve this, we can reduce their COVID risk and reduce their risk for dementia. How nice to know, di ba? Now, recently we achieved some funds from the WHO We Pro Mental Health Unit, and there are now resources on dementia during the time of COVID, a project of the Institute on Aging. And you can look at our links here on YouTube, etc., on some of the lectures that we gave concerning this topic. So please access these lectures on YouTube. Now, so how do we sustain a supportive environment for senior citizens during and after the COVID-19 pandemic para nakakalabas, di ba? Nakakalabas and safe and comfortable, less anxious ang ating senior citizens. So let's talk about the health systems for older persons. In that same study, Fit for Frail, we found out that health services specific to the needs of older persons are available but variable, especially in hospitals and health centers. Most services are outpatient-based. In fact, inpatient services are not specific or comprehensive for older people. Sadly, nobody was able to access a public home care service. And remember, during COVID, home care services became so very important. Wala pala, no? Ang public or at least something that is funded by PhilHealth, wala palang ganon sa home care service. The lack of trained staff who can implement programs for older persons is also a major constraint of the health system. There are not enough mental health staff trained in geriatric care, and there's insufficient budgetary provision for health services for older persons in government facilities, and the health care system is unable to meet the needs of older persons in relation to leading causes of morbidity and burden of disease, especially a lack of medicines and services for dementia. No? Now, hindi lang naman syempre DOH or government. No, we in the community have a role to play. Older persons may safely go out in level 1 areas And, our communities have to be age-friendly. And that means social support, protection against discrimination and ageism, protection against violence and abuse, continuing education and literacy program, spaces to walk and be active, di ba? Sabi ng isang na video natin na kailangan na nilang lumabas at maglakad, di ba? Kailangan na nilang mag-exercise, maarawan. And we need enabling technology and regulations for all of these. Older persons are encouraged to volunteer and mentor activities that they can do with family members and friends online or face-to-face now that we are in level 1. LGUs and especially barangays can help support seniors who are homebound by checking in on them daily and helping deliver food and medicines to them. Okay? So let us achieve, and we can achieve healthy aging despite the challenges of COVID-19 and beyond this pandemic. You may contact and follow us up through these numbers and social media platforms. Thank you to TVUP, Stop COVID Deaths Organizing Committee, and to you, our audience, and to all of the participants and researchers in the Fit for Frail and UPWise research programs. Thank you very much.
Thank you so much, Director Shelley. Marami po ako natutunan dun, at lalo na po dun sa aking focus, which is your publication with Dr. Susie. Maraming salamat po. Dr. Susie?
Salamat po.
Oh, Raymond.
Okay, sige. Okay.
Mute ka yata eh. Thank you very much. Thank you very much, Shelley. No, I'm sure our audience has a lot of questions, and as always, it was a very comprehensive, very tight presentation, giving us a good way of framing these issues. No, hindi pantay-pantay lahat. Kailangan marami tayong ibang mga iniisip. Pag-usapan pa natin yan. Sige, Raymond, introduce natin ang next speaker natin. Suki na rin. Suki.
Thank you, Dr. Susie. Our next speaker po, kilala niyo po ito. Well, she used to be the Dean at the College of Public Health at the University of Philippines, Manila. But for our COVID response, talagang even in the interviews po, makikita niyo po si Dean Nina because she's the chairperson of the DOST Vaccine Expert Panel po. So, without further ado, we'll call in Dean Nina Gloriani po.
Yes, thank you very much, Dr. Raymond. Good afternoon sa inyong lahat. Dr. Susie, Dr. Alvin, andito lahat. And of course, Dr. Shelley, thank you very much for that very comprehensive presentation. Of course, isa-summarize ko lang ng konti para doon sa reaction ko. Okay? I have 8 slides lang naman.
Go ahead, ma'am.
Better. Teka lang. O yan. Teka lang. Ano pa ito? Ayaw. Yan. Safe na nga ba lumabas ang mga seniors? Well, senior ako. Gustong-gusto ko na rin lumabas. So, alert level 1 tayo ngayon. Tignan natin. I put this together, yung TVUP and other questions that to me would need clear, simple answers. And actually, marami nang sinagot si Dr. Shelley, no? Pero, let's just put them together again, no? Para mas I hope mas simple. So, yung una is how safe? Safe na nga ba? So, we have to do risk assessment, and a lot of risk assessment was already explained by Dr. Shelley. We have to weigh the risks and benefits of going out for seniors, and she gave us 3 case studies, no? Pero siguro dahil nasa vaccine program ako, I'll delve more into the status and vaccination levels of senior citizens. Ang question, have most of the country's senior citizens been fully vaccinated and boosted already? So, andito yung sagot doon sa question. National coverage for a 2 full vaccination is currently ngayong March, no? March 9 yan. At 74%. So, at least meron pang 36% that remain unvaccinated or partially unvaccinated. And meron namang mga 45% na boosted. I'm sorry, baka hindi to 45. Okay, anyway. So, ang question is, are older people entirely safe just because they are vaccinated? Pwede din itanong yan. Safe na ba? O bakunado na ako? Narinig natin kanina doon sa mga interviews, ano? But should people around them be vaccinated as well? And for the unvaccinated naman, so yung una yung vaccination, then yung mga hindi pwede or ayaw pa o may konting hesitancy pa, are they at risk of contracting the virus? Of course, definitely yes po ang sagot dyan. So ito, this is also a favorite slide of mine. Yeah, makikita natin yan. The unvaccinated who get COVID-19 shed more viruses for longer periods than those who have been vaccinated and got breakthrough infections. So makikita nyo ito pong red, yan yung mga dots dyan na red, yan yung mga viruses na mas marami kapag unvaccinated yung nagka-COVID versus yung may bakuna. Ito nandito lang sila. And then longer. Marami ang virus na natatransmit nila sa iba at mas mahabang panahon tinatransmit nila yan. And then we should not forget, kaya nga medyo tumagal tong ating pandemya ay because of the variants of concern, the variants of interest, kung ano-ano pa mga variants that are emerging. Especially we're now looking at the Omicron. At meron po tayong Omicron, original Omicron variant, pero meron din pong sub-variant. Ito po yung anak ni Omicron. Now, this is actually affecting Hong Kong right now. Actually, meron tayo siguro noon, hindi masyadong clear yung ating genetic kung ito ba ay yung sa atin ay BA.2 or .2, meron pa silang kung ano-ano dyan. No? Just look at this. No? The original is called Omicron BA.1, pero may mga anak siya na iba-iba ang tawag ng iba-ibang scientists. So, but what is clear is that it may also come in, if it has not come in, and this happens to be more transmissible than the original one. Or the other question is, could other variants emerge that are even more transmissible? Kasi habang mayroon pong mga tao na yung transmission, habang transmission goes on, while it goes on, there is that higher probability of the virus mutating. So pag nag-mutate, ito na naman si variant. So, could these variants be even more transmissible? Right now, itong BA.2, 30 times more transmissible daw. Or some variants would cause more severe disease. Ayaw na ayaw, syempre natin yon. Or actually, some of these variants already showed that they could evade vaccine-induced immunity or even natural immunity from original strains. So, ito ang ating considerations. Pinut together ko na lang ito, no? Vaccination status of senior. Ang tanong, naka-full vaccination ba sila? Partial lang? Isa lang? Dapat dalawa? Meron namang isa lang dose, no? Pero kung dalawa ang kailangan, dapat dalawa. So, partially lang sila immunized. Or naka-receive na ba sila at least one booster dose? Kasi there are considerations for a second booster at this time. So titingnan din natin yung vaccination status ng community, kung saan siya gumagalaw, itong ating senior, yung immunization coverage. Importante po yun, no? Then we look at their own risks and vulnerabilities, yung kanilang health status, level of immunity, the comorbidities, and yung extreme age, as already expounded by Dr. Shelley. No? We have to scan the environment, the COVID-19 prevalence in areas to be visited by our seniors. Kung densely populated ba yan? Open air ba yan? Close? Or ano yung profile of the people our senior will likely meet? And the duration of exposure outside, kung gathering ba ito, party, meet up, or short lang naman, no? Meet up. Then, what activities to engage in, what to allow, and what not to engage in. And, very important is the use of protective gear. So, wear PPE, preferably, alam naman natin yung mga surgical, medical, okay, lalo na kung better kung N95 mask, especially for the elderly, and then the minimum public health precautions. So, in short, parang what I'm trying to say here is there has to be parang a matrix, go or no go, depending on all of this, vaccination status, risk and vulnerabilities, the environment, the activities, and of course, yung aware ng PPE. So, I have been presenting this in many webinars. Makita nyo, ito yung sagot nga, 74%. This is national vaccination coverage per priority group as of March 2. Nasa 74% ang A2. So, medyo pwede na yan, pero makita nyo, dapat nasa green. Yung green ay yung A1, A1, ito yung mga outbound, and understandably talagang immunization lahat. And then yung A3 nasa 93%, pero si senior nasa 74. We do not worry about the others yet kasi kay start lang no sa mga pediatric. Pero mayroong exposure ang mga senior citizens to the pediatric age group who have not received their vaccination. So we have to consider higher vulnerabilities to COVID, of course, due to old age plus their attendant comorbidities. So, ito nakuha ko lang from WHO, pero last year pa to. Pero it speaks of how well the different regions of the Philippines actually immunize their people. So, NCR, I think, is still best. 90% na tayo, 93%. But we have to consider others na nasa red, especially BARM. And so, I just wanted to include this. Ito is a very nice paper on a UK observational study on the characteristics of SARS-CoV-2 infection after first and second COVID-19 vaccination. So, it highlights the need to complete the vaccine and as also maybe to give the booster. So, just some of the salient points. Some individuals will become infected. This is clear now that some individuals still become infected with SARS-CoV-2 after vaccination. Ito yung tinatawag nating breakthrough. But vaccination compared with no vaccination showed reduced odds of hospitalization or having more than 5 symptoms. Grabe yung kanilang study, pati yung mga symptoms binilang nila. In the first week of illness following the first or second dose and long duration of symptoms following the second dose. So comparison of the vaccinated versus the unvaccinated. Now almost all symptoms that they actually reported were listed were reported less frequently in infected vaccinated than in infected unvaccinated individuals. And their data showed also or suggested that frail older adults and those living in more deprived areas are at increased risk of yung mga complications of COVID. The study found that frailty was associated with post-vaccination infection in older adults more than 60 years after their first vaccine dose especially. So adverse determinants of health such as living in highly deprived areas including obesity were associated with an increased likelihood of SARS-CoV-2 infection following the first vaccine dose. Now, they have this data also that show that vaccinated participants who got COVID breakthrough were more likely to be completely asymptomatic, especially if they were 60 years old. Kasi nga bakunado, no? Either asymptomatic, walang naramdaman, pero may konting virus na nakuha, or may mild symptoms. But for those who get symptoms, COVID-19 appears to be less severe, and we have seen this, Dr. Shelley has said this, less severe in vaccinated versus unvaccinated individuals. Thus, strategies such as timely prioritization of booster vaccinations and optimized infection control measures should be considered, especially for at-risk groups. So, I managed to get some photos. These are all photo credits to CNN Philippines. Silang pinakamaraming photos. Ito yung naging alert level 1 na paglabas ng ating mga kababayan. No? Of course, may young, may old. Pero makikita nyo may mga old. Ang issue ay, para bang ito ay alert level 1 or alert level 0? Kasi yung alert level 0, sige, lahat, pwede na, normal. Some with masks, properly worn, but others no, not. So, paano na yon, no? So, what I'm also saying here is there should be careful, very careful consideration of scenarios for seniors who will be allowed to go out of their homes. So, ito ang take-home messages ko. The protection of the elderly seniors in vulnerable communities is very important under alert level 1 conditions where quarantine restrictions are relaxed and where more people are allowed to go out. as a panel, a member of the panel, yung vaccine expert panel, we really have very good data on the role of third doses or first boost ito, no? So booster doses, they should be considered, not just the primary doses, for added protection, especially with the Omicron-driven surge. So roughly, only around 9.7 million, less than 10 million Filipino adults have received boosters as of February 22. And we are targeting 72. So meron pa tayong 60 million na hahabulin sana in order to really protect us and provide us that immunity wall that we have been talking about, no? So being a heavily mutated variant, alam na natin yung si Omicron. The protection we get from 2 doses is not enough to protect us against the Omicron. Adding a booster dose would retain our protection as shown in many studies, especially against BA.2, the more contagious version of Omicron. So, as a public health person, no, talagang the crucial role of masks. So, I don't think I will throw away my mask even for the longest time. Hindi ko na po siya tatanggalin. And for everyone, well-fitted face mask should be worn properly at all times, whether outdoors or in indoor, private, or public establishments, including in public transportation, by land, by air, by sea, of course, except when eating and drinking, and while participating in other activities. So yun lang po, and I hope our seniors will all be able to go out, but we have to consider the risks versus the benefits, and of course the importance of having everyone vaccinated and boosted. Salamat po.
Okay, thank you very much. That's former Dean of the College of Public Health, Dr. Nina Gloriani. And ang ganda ng tandem nila ni Shelley, no? Parang nakafocus naman si Doc Nina dun sa the role of vaccination. Okay, so we're going to have a speaker now from the private sector, and it's my pleasure to introduce President of the Philippine College of Geriatric Medicine. He's also head of the Geriatric Center of St. Luke's Medical Center in Quezon City. We'd like to welcome Dr. Eduardo Rommel Poblete. Welcome, Dr. Poblete.
Thank you for inviting me here, Dr. Susie.
Sige, go.
Thank you, Shelley, for that very informative lecture that you gave. It's timely that you opened up the concept of frailty among the senior citizens. It's worth noting that indeed the status of their health is a big factor in answering the question whether pwede na lumabas ang mga senior citizens. Just a few notes on this topic. We, the private sector, have been quite confused on certain data that has been coming around. For instance, on the population of the senior citizens in the Philippines, there has been some discrepancy in numbers. We know that as early as 2020 May, based on the Philippine Census on Population and Housing, there's around 11.31% senior citizens out of the 109 plus Filipinos. That's roughly translated into 12,366,355. And by DOH accounts, based on their July 2021, which is last year, as reported by the WHO Western Pacific report, there's about 8.5 only senior citizens in the master list. So this actually gives a lot of confusion in the data that we have, but it's quite comforting that Shelley has very new and updated data, especially on the status of healthcare in the Philippines. True, we need to classify the patients and consider how frail they are or how robust they are before we even think about the question of pwede na ba sila lumabas. But we must consider that the senior citizens are the most hardly hit by this pandemic. The severity cannot be overemphasized, And in 7 out of 10 deaths, that is attributed to senior citizens. Until, I think, today, that's true. And the higher COVID rates, we know, that occurs among senior citizens is because of their aging, the physiologic changes that they have to undergo, like chronic diseases, immunosenescence or aging of the immune system. There is more severe inflammation and therefore more severe organ damage is expected. There's also the aging respiratory system and comorbidities that may be responsible for even long-term complications in these patients. Now, an important issue that we want to take up also is about the immunization of senior citizens. Dr. Anina has presented so much about data on the vaccination status of our senior citizens. And however, I came across a study that's very interesting. This was published in January of this year about the hesitancy in COVID-19 uptake among 6 Asian nations, including the Philippines. Why are patients a bit hesitant in having their vaccination? First, may it be the primary series or the booster. And they saw the relationship between age and that hesitancy, even the socioeconomic status, even the residential areas where the urban are more likely to have the vaccine as compared to the rural areas. In education, where of course, the higher the education, the less hesitant you become. And even employment, so that the unemployed are less likely to have the COVID-19 vaccines. In age, there is an increasing hesitancy as we grow older. That was the relationship they had. In socioeconomic status is surprising because the higher the socioeconomic status, the more hesitant you become. Meaning, there are more rich people in the Philippines who do not want the vaccine or are hesitant to have even the first series. So, what are the recommendations from our end? From the geriatric community, we suggest that we have targeted strategies in these immunizations. We should have more vigorous outreach programs that may include education. Now that we have the multimedia system, we must increase the access. How? We must offer, the government may be able to offer vehicle services for the senior citizens who are hard at walking or who have difficulty in performing the activities of daily living. There must be senior lanes that are exclusive and even seniors-only vaccination days. And of course, the most practical house-to-house by the barangays. So we cannot overemphasize the importance of immunization at this point in time, where we, by our estimates, we only have about 7.7 million, or about 62.8% primary series completed based on the recent announcement of the LH in March 1. That only is 62.82% of the primary series have been completed in about 7.7 million adult or older adult in the Philippines. So we hope that you join us in convincing our seniors to be more, to be less hesitant in having their COVID-19 vaccines, so that we can easily answer and confidently answer the question of pwede na ba sila lumabas or easily, and say yes, they can. So salamat po sa pagkakataon binigay niyo sa amin sa private sector, and for the answer to Dr. Shelley's question of whether we have improvement in the services. Yes, I think we have more geriatricians now than ever. We're close to 200 now, and we have increased by 4 more the training institutions around the Philippines. Now, so from the Lone St. Luke's Medical Center in Quezon City, we now have training in the Global Center in Global St. Luke's. We have now in National Center for Geriatric Health under Jose Reyes. We now have training in National Center for Mental Health. And of course, we are going to open one in Batangas City. So thank you very much again. Dr. Susie, back to you.
Thank you very much. That's Dr. Eduardo Rommel Poblete, who is president of the Philippine College of Geriatric Medicine. And we'd like to welcome all the members of the College of Geriatric Medicine who are watching today. Okay, so we are going to ask our panelists to open their video. We're going to ask Dr. Poblete, Dr. Nina, Dr. Shelley, and Doc Alvin to open your videos. We're going to have an announcement from Raymond before we go into our panel. And for those of you who have questions, please put them in the Q&A box or in the chat. So I've seen a number of questions, very interesting questions already, but now's the time to ask your questions. Okay, so Raymond, over to you.
Thank you, Dr. Susie, and thank you also to President Ed Poblete of the Philippine College of Geriatric Medicine. Before we proceed with the Q&A, let's just take a very, very quick break for our special public service announcement.
O sige na, anak. Parang kagat lang ng langgam. Hantik o yung kumikiliti lang. Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ko rin po ang color nito. Pero ayoko po ng red hantik. Masakit kumagat at takot rin po ako sa blood. Magtudugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O, heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Color rin yan for love. Thank you, Doc. Thank you, Nay. Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children age 5 and above. We hope that this message is something that will be carried on po by parents and guardians so that the children po could be protected against COVID-19. Over to you, Dr. Susie.
Parang kaboses mo yata, Raymond, yung doktor dun sa cartoon na yun. Okay, so anyway, okay, so we'll have our first question for our panelists, and Raymond is of course scouring the questions from both Facebook and YouTube, and also from the Q&A. But let me just ask kind of like a simple question for all our panelists, right? Kasi okay nga yung sinasabi ni Shelley, no? Titingnan natin yung frailty, no? Hindi hindi pare-pareho lahat ng senior. But let's say in general, let's say meron tayong senior, malapit na yung Mother's Day, di ba? Gustong kumain sa labas, for example, no? What are the considerations? What would you consider as red flags. Wag dito sa lugar na to, di ba? In general, wag sa lugar na to because of what? Okay, so I'm gonna start with Dr. Poblete. I'm sure you get that question from your patients. Go ahead.
Yes, yes. Well, I've encountered those questions. They are very practical ones, and usually we advise the patients to try to consider places na number one, hindi crowded.
Okay.
Okay. Yun yung mga external or environmental considerations. But, of course, unang-una i-consider niyo po ay status ng pasyente. Is the patient up to it? No? Bukod sa sabihin, oh, may immunization na yan. Or kakaroon lang niya ng COVID about 2 weeks ago. And now she's okay, she's been cleared. Okay, so meron mga internal factors sa pasyente na halimbawa, on that day, nagkaroon siya ng sipon, ubo, lagnat, something that's going to derail the function of the patient. We advise them to better not do it, to try to reconsider maybe some other time, or maybe just doon na lang sa bahay, or baka mas mabuti na ilimit na lang yung kanya munang movement to people who's taking care of her, and best to wait for her to recover. Kasi mas mabilis siya makaka-recover, I think, kapag hindi ma-complicate yung kanyang sakit. And then, yun sa mga external din, is how long is it going to be for her to reach that destination? Baka naman kasi meron mga iba that celebrate out of town. That's going to take a toll also on the seniors.
Yeah. Yeah.
Lalo na yung mga out of town na ganyan, tapos walang break, wala malang toilet break, wala mga gano'n. Hirap na yan, pagod na yan. And immunosenescence will also take its toll. Pag gano'n, buyat pa, hindi pa sila makatulog out of excitement. Dahil araw-araw pinapaalala nyo, malapit na. So, nag-anticipate na yung matanda.
Oo naman, oo, correct.
Anticipate na sila, alam niya naman sila, yung matatanda, hindi pwedeng mahuli, hindi pwedeng dapat maaga tayo. Isang oras, maaga na tayo. Okay, so, these are factors that will remain unanswered until you look at the patient and talk to the family a little bit more in depth about any activity that might potentially harm the patient, not just for COVID infection, but on other diseases as well. So it's a general answer to a general question about movement of seniors around. So, salamat po.
Thank you, Dr. Poblete. We're gonna hear from Dr. Alvin. At naisip ko tuloy, alika magmerienda tayo sa Baguio, di ba? Okay, Dr. Alvin, go ahead. What do you think? What are the general considerations for eating out?
I think importante yung mga kasama niyo sa bahay kasi, for example, my wife always prevents me from going out of the house. Although lahat kami bakunado na eh. But there is still that anxiety kasi hindi namin makalimutan yung time na nagkasakit kaming lahat and we isolated ourselves and we quarantined ourselves for a long time. Hindi namin somehow it leaves a mark eh. Hindi mo makalimutan kung ano yung naramdaman mo noon and you wouldn't want to experience that again. So siguro yung mental health, yung psychological factor is very important na ma-overcome. Kaya ngayon na lang pagka marami kaming tao nakikita o kaya pag may umubo lang nakatabi mo, talagang natatakot ka pa rin eh. Kahit na alam mo baka
Tatayo ka na.
Lalo na sa simbahan. Pag nasa simbahan ka nag-misa, tapos may uubo-ubo dun sa likod mo, sa tabi mo, yun yung, siguro yung, the point is, dapat siguro i-allay natin yung anxieties, Kasi once you have experienced the symptoms, hindi mo mawawala eh. Tapos alam mo, nandyan pa rin naman yung COVID. I guess we have to overcome that.
Oo, parang it's para siyang PTSD, parang post-traumatic stress. No, lalo na dun sa mga nagka-COVID within the family. Shelley, what would you like to say?
Well, let's talk about PTSD. That's very true, no? PTSD after severe COVID, especially those who were hospitalized or were in the ICU. That is a true event that we have encountered, no? And of course, there are ways to deal with that. Kailangan talaga ng counseling dyan, PTSD. Pero anxiety has been heightened also during this COVID pandemic. Madaming anxious, di ba? Madaming, dati hindi naman masyadong OC, na OCD na. No? At saka, pero in contrast naman, wala pa tayo sa level 1, level 2, and level 3. Sorry nagpunta kami sa isang masarap na restaurant sa Tagaytay. Ang sarap talaga dun no? Aba, may mga matatanda doon naka-wheelchair, kumakain. Aba, lakasan ng loob yata talaga, di ba, Dr. Gloriani? Pero alam mo, yung malalakas na loob, hindi ko naman siya na-discuss as a case, no? Pero ang pinakamalakas na loob na senior citizen ngayon, na lumabas, at lumalabas sila, maniwala kayo, ay yung mga nabakunahan at na-booster na at nagka-COVID at nag-recover, ang lakas ng loob nilang lumabas. At sa akin naman, basta naman mag-face mask, face shield kayo, and all of the things that, Dr. Poblete mentioned as a precaution, and Dr. Gloriani had this beautiful table of what to look out for. I think it's safe for them. Talaga, kasi may mga tao naman na talaga dahil sa matanda na sila, naranasan na nilang lahat, hindi na sila takot mamatay. Hindi na talaga. May mga hindi na talaga takot mamatay. Kaya ngayon, nung nasa mall ako nung isang this weekend lang, no, isang magandang mall, daming naka-wheelchair na mga matatanda ang paikot-ikot na sa mall. So, it's really also their choice, di ba?
Yeah, thanks, Shelley.
Thanks, Susie.
Yeah, I was gonna ask Nina, from the point of view of being, maganda yung kay Shelley, malakas ang loob nung nabakunahan at nagka-COVID na. So, Doc Nina, if you have had COVID and you've been vaccinated twice plus booster, mas malakas ba dapat ang loob mo?
Doc Shelley, tama yun, no? Kasi meron tayong tinatawag na hybrid immunity na better than natural immunity alone or vaccine-induced immunity alone. Kita yan sa mga data na talagang pag merong natural immunity, binigyan mo pa ng bakuna. Kaya nga ni-recommend namin yan. Una pa man, nung nagkaroon ng mga COVID, no? Wala pang bakuna noon. After nagkaroon ng bakuna, may data sila that showed na yung seropositive, meron silang immunity dahil nagka-COVID. Nung binigyan, isang dose lang at that time, ay gumanda lalo yung kanilang neutralizing antibody. So hybrid. Pero huwag kayo magpapa-infect para lang makakuha ng hybrid.
Pero, Doc Nina, pero despite that, pwede pa rin ma-reinfect, hindi ba?
That's true. Kasi yung mga variants ang ating iwawan.
Yeah.
Yeah.
Oo. Sige, okay, let's go to Raymond. Raymond, ano bang napili mong na-harvest mong question dyan?
Well, we chose, I think, the question that is most top of mind for those, kasi we see this in the YouTube po and the Facebook. The question, and we'll post this to the chair of the VEP. Ang question po, Ma'am Nina, is or at least napag-usapan nyo na po ba ito, do senior citizens need a second booster dose?
Yes.
For them to be allowed to roam the streets, etc., etc.
Right, Doc Raymond and everyone. Actually, meron na kaming rekomendasyon. Pinadala na namin niya sa FDA. I think the DOH knows about it. Kaya lang pinag-uusapan pa at the level of the all experts group. Kasi may mga levels tayo ng experts. Tapos, hindi lang kino-consider yung technical plus yung mga socio-economic benefits. Kasi ang gobyerno ngayon ang bumibili ng mga bakuna. So, may mga cost din yan. Pero I'm sure na eventually, in a few days, baka sana lumabas na. A second booster, lalo dahil sa Omicron.
Okay. Ma'am Nina, to be clear, the recommendation of the VP is yes. Tama po ba?
Yes.
Okay. Okay po. Thank you po. Thank you, Ma'am Nina. The other one, and I think this is, syempre nung mga bago-bago po yung COVID, and it's something na medyo nakasanayan na po, and up to this day, I think is a ritual. When you go out, you immediately take a bath or you remove your clothes, segregate it, etc., etc. The question coming in from Celia Balbin from UP Nismed is, ganun pa rin po ba ang dapat gawin? Importante po bang ganun ang gawin even if you're not coming from the hospital, maybe you just went to the mall or something.
Hindi
Pagka
mo pwede na,
pag-uwi mo,
sabihin, pwede na huwag maligo.
pagka-uwi mo, ligo ka ba talaga kagad or okay lang bang medyo hindi muna ganoon po? Yung
Hindi
po
na
ang
maliligo, okay.
Masasagot niyan. Ako muna.
Sige po, ma'am. Opo.
Actually, ako naging paranoid because of COVID. Kaya talaga basta lumabas ako, I have to do that. Lahat ng disinfection, lahat ng yan, no? Hindi na yan mawawala ngayon. Basta lumabas. Sorry. Si Dr. Shelley natatawa.
Yes, ma'am.
Go ahead, Ma'am Shelley. Go ahead po.
Importante man talaga yung hygiene, ano? Kasi kung minsan may umubo pala sa likod mo, hindi mo alam man nakakapit sa buhok mo. So yes, pinaka-minimum siguro is when you get home, you handle your mask properly and if you can wash it, wag mo muna kung ayaw mo nga itapon, pwede naman. There are some instances when you can wash your mask and wash your hands. Definitely change your clothes as much as possible. That's the best way really to deal with the current situation. Pero we have data that hindi na masyado yung fomites. Yung sinasabi lang fomites yung dumidikit sa mga baro, tsaka hindi na daw masyado yun. Pero depende rin sa variant eh. So baka may variant na lumabas na madikit siya sa fomite, ganun din, di ba? So mag-ingat na lang. Anyway, mahilig naman tayong mga Pilipino na maligo kahit 2 times a day. So, lalo na ngayon, tag-init.
Yeah, speaking of tag-init, no, very practical question. Kasi dati mga seniors, isa sa mga simple joy nila ay manood ng sine ng libre. Di ba? So, in general, what's our advice about watching movies?
Nako, hindi ba, hindi pa yan masyadong allowed. Sa I think sa alert level 1, there are some facilities and establishments that really cannot open the same way that they did before the pandemic. And movie theaters is in the list, diba?
Yeah, so parang yun kasi gusto ng mga senior, di ba? Kasi malamig.
Oo. Malamig. At saka may discount. May discount yan.
At saka libre. Sige, Raymond, baka may question ka pa dyan. Meron ako rin.
Question coming in from Rosel Tovera. She wants to ask if has there been any study or evidence comparing the immunity level ng hindi pa nagpabakuna pero nag-recover po sa COVID versus hindi pa po nagka-COVID pero nagpabakuna na among the elderly po. Meron po bang, does one have better immunity over the other?
I will have to answer that. It depends on the person. Kasi ang immune response to a natural infection will also depend dun sa kanyang general health status at even dun sa vaccine-induced immunity. So, hindi natin ma-generalize yan. So, ang importante siguro maintindihan kung ang isang senior ay generally healthy, nag-recover. Ang isa pa dyan ay ang nakuha ba niyang infection ay mild, moderate, or severe? Kapag mild lang kasi, mababa relatively ang immune response versus dun sa nagka-severe na nag-recover. So, kailangan tignan isa-isa.
Sige, I have an interesting question here from one of our viewers na what do you do about organized anti-vaxxers in the community? How should you... I have a personal answer to that. We're gonna ask our panel. How do we handle these anti-vaxxers? Sige, anybody can start. Lalo na yung they're trying to convince others not to be vaccinated.
I think Dr. Ed has an answer, Dr. Susie.
Yes, go ahead.
Okay, we have a lot of those experiences sa mga anti-vaxxers. We even had a patient, anti-vaxxer, nagka-severe COVID na. Okay, so during that illness, the course of the illness, papabakuna na ako. Okay, ako naman, teka ho, pagaling muna kayo. Okay, so after 4 million and 2 weeks, tinanong ko na, sige, I'm going to schedule you. Hindi, ayoko na ho, hindi na ako magpapabakuna ulit. See? So sabi ko yung a lot of 4 million. Ha? The most important thing there I asked was why. I think even in the patients in the clinics, the important thing there, and the first thing you should know is why. And you will see na napaka-varied ng kanilang mga reasons. Meron mga reasons na kasi basa nila magiging zombie ako by April 2022 pag nagpapakuna ako. Sabi ko, luma na ho yan, ibahin niyo na. Kasi 2019 pa namin naririnig yan na magiging zombie ka. Sana wala na yung nag-vlog na yon. Tapos meron na magsasabi na kasi ano yan, well, parang it's made in USA and designed to control people in the future. Marami mga conspiracy theories na mga pinapalab. Kaya I think there is credence to the study I mentioned earlier about vaccine hesitancy being highest among the rich people. People in the higher income status have more hesitancy kasi they have access to a lot of information, whether good or bad. Pero malamang, they also have a richer imagination as rich as their pockets so that they can even think about aliens, alien invasion, conspiracy theories, yung magiging zombie. Ang dami nilang mga dahilan, but I don't find anything as sensible as I simply don't want it. Because kamukha states na I want to exercise my right to refuse. Wala akong naririnig na gano'n. And I even had that patient na mga well-placed sa ating lipunan. Justices of high courts, mga retired generals, they have these wild reasons kung bakit. So I think there should be a follow-up to this study and ask the question why, lalo na sa Filipinos. Kasi I think that would be quite fun and very interesting siguro para sa atin. So yun. I think the most important thing is why.
Yeah. Nice.
Why?
Shelley, what do you think?
Susie, iba yung vaccine hesitant sa vaccine anti-vaccine. Anti-vaxxer. Magkaiba yun eh. We need to target these vaccine hesitant groups because they are still undecided. And they are the people who need information. So let's build trust with them, talk to them about safety processes, how vaccines were developed, how vaccine safety is assured, no? Including communicating with the healthcare sector because there are physicians who really do not recommend vaccines to their patients. Maybe some would recommend it to a specific age group. We're talking about older people here. But once a patient is already in their 90s, ayaw na nila. But they would agree that those in their 80s can still be vaccinated. So we need to educate even the healthcare sector about safety, communicate vaccine safety to them. And then, of course, talk to community and religious political leaders. Ang Vatican came out with a communication brochure, no, on how to talk to communities, religious communities about the safety of vaccination. And that was quite helpful, no, because there were some religious people who were talking about who were anti-vaxxers, no, while they were giving their sermons in the pulpit in certain communities here in the Philippines, no. So let's approach these leaders, political community leaders, on vaccine matters. Let's not exclude them in the conversation. But let's also remember that there is a historical basis maybe for their hesitancy, no? Some would say it's because of the Deng Baksha, no? But remember that elderly of today probably did not have childhood vaccines. So they had never experienced getting childhood vaccination. Yun yung mga 80-year-olds natin, 90-year-olds, hindi sila nabakunahan ng bata sila. So they had no experience of getting vaccinated. And maybe when they were raising their children, they also did not have that experience of sending their children, who are now maybe in their 60s, to get vaccinated. So yun yung mga parang background dyan that we need to understand. So very important now is to really get the young, the mothers, no, and even their grandchildren, even involved in childhood vaccination, because these young children will, have that experience of having benefited from childhood vaccines, and will, eventually as they become adults, be more open to adult vaccination and even vaccination against pandemic related viruses. Yun ang
So,
aking take dyan.
yeah, you have to really counteract the misinformation with constant information, no? Constant, accurate, and evidence-based information. Ma'am Nina, I'm sure this is the bane of your existence in the expert panel. Mga anti-vaxxer, what do you think? How should we get them? How should we deal with the anti-vaxxers, especially those who try to convince others?
Well, actually, kami ay science-based, no? Yun naman ang aming communication parate. But we need the help of the social scientists kasi mas magaling sila mag-explain and alam nila paano puntahan to mga hesitancy. Pero we're always going back to being science-based. So we have to give them, provide them the data. Kaya nga, we continuously monitor ang mga what's going on. So yun lang siguro, pero doon sa iba kailangan namin ng social scientists, yung mas communication experts.
Yeah, especially, I don't know, for me, there's certain people who really fall easily into this conspiracy theory.
Yes, totoo yan, Susie.
Diba? Parang they're really kahit na anong situation, yun ang default nila, yung very irrational. No? So anyway, Doc Alvin. Si Doc Alvin kanina pa gusto magsalita. Sige, ano tingin niyo sa mga anti-vaxxer?
No, there are groups kasi other doctors who believe na dapat daw hindi external yung treatment na binibigay. Dapat daw yung strength of the body should come from within, ano? And it is we have to develop the immune system of our body without getting the vaccines, because that has been shown daw in some of the experiences of others when the vaccines were still not around. Pag malakas yung katawan mo, malakas ka inside, hindi mo na kailangan ng vaccines.
So yun ang paniniwala nila, parang gano'n.
Oh. So ang point ko lang is that may logic naman pero pwede naman siguro natin from within and from without yung ibibigay na strength din sa tao, diba?
I agree. I think that's correct. It's just that in the context of an epidemic or a pandemic, right, where you have a highly transmissible microbe, parang yung the odds are you're gonna get it, right? So that's why. Anyway, sige, Raymond, ikaw naman dyan.
Question naman po is, how important, I'll pose this to Director Dela Vega. So, syempre, yung mga elderly po, when you reach a certain age, you really are dependent on your schedule, on your norms, on your ritual. But because of the pandemic, biglang na-halt yon, sa bahay ka lang, etc. So, how important is it for the elderly to maintain that ritual even if nasa bahay pa lang po with regards to talking to their friends, etc., ma'am?
Oh, it's very important for mental health, no? Certainly. Very important, especially for those with dementia, that they stick to a schedule, because it gets very confusing for them. They forget where they are, what time it is. No, meron akong pasyente na akala niya nasa Amerika pa siya kasi hindi siya lumalabas ng bahay. Nandun lang siya sa loob ng apartment. So what you really need to do, especially for those with dementia, is to keep a schedule, no, for them. It also calms them, by the way, no. But for those without dementia, it's very good for you, for your mental health, to keep a schedule. Even for us who still work, no, when it's time for work, I dress up as if I were going to work, and it helps me think about, being serious about what I'm going to do for that day. And then, of course, meal time should always be preserved. Exercise times, time for prayer and meditation, very important. So continue that. Very good for mental health. Most importantly, to get in touch with family and friends.
Okay. So Raymond, I'm mindful of the time, no, and we're I know our speakers would like to have a few more minutes in their parting messages. Pero do you have any other? Maybe we can take one more question.
Oh, okay. So, which one should be good? Well, mostly are anti-vaxxers and vaccine hesitant people naman po, and a little anecdotal sharing po. So I think this question is very important, although it's medyo napahagingan na rin po ito. What about, obviously we're talking about seniors just going out of the house and then going back to their house after grocery, punta sa mall, etc. What about travel po ba? Is it okay for the elderly to travel, whether it's by boat, by bus, by plane, kung ano man po? What's the advice of the VEP, Ma'am Nina?
Well, actually, under alert level, okay. Nung isang araw lang I had to answer that question. Yung dahil do sa IATA rule na
Yes po.
alis ng mask.
Yes, ma'am. Yes, ma'am.
Actually, then I had to dig up researches or data ng mga, especially airlines, ano, na yung pala sa mga eroplano especially, ang airflow ay maganda na si-simulate niya yung parang naka-distancing ka. But of course, kahit magkakatabi kayo, di ba? Kinuna nila nung data ng simulation and actual data yung iba na meron palang ganon yung airflow na pababa, one direction ng niya pababa, tapos lahat ng tao naka isang direction lang ang tingin. But of course, importante rin na merong mask. So yung well-fitted mask, pero tinignan din nila na yung nakamask at hindi nakamask, better talaga yung reduction in possible infection kung nakamask. So siguro right now, I'm going to travel soon. Medyo confident naman ako. Basta nandun yung mga dapat bakunado kayo, better kung nakatatlo, then you wear your PPE properly, tapos hindi natin maano yung length of time ng pero siguro for the elderly, wag muna yung masyadong mahahabang flights. So and it's not just inside that you can get the infection, pwede rin kasi outside sa airport itself. So you have to be conscious of that. So yun, para sa akin okay naman na.
Yeah, I think that's a good point, no, na actually the airplane might be okay, pero yung pagpila, yung siksikan, no, and especially elections are coming. You know, I don't know, people will have to be traveling, going to the precincts, etc. Anyway, sige. Okay, so we're going to give our panelists a couple of minutes to think about their parting message for our frontliners who are watching us today. And meanwhile, Raymond is going to go through the answers to our poll.
Opo. Yes. So the first question, obviously, I'll be calling in Dean Nina. The question po, and this just for everyone's benefit din po, no? Reads, ilang porsyento ng mga senior citizens ang nabakunahan na? Is it 84%, 74%, or 64%? Ma'am Nina?
Okay. Ang sagot dyan kasi 74. Yan yung March 2 data natin. And siguro, I also of course heard Dr. Ed na meron siyang 62, 63. Actually, depende yan sa ginagamit na denominator. Yung target population, kaya medyo naiiba. But that was from the rest bakuna data, so we use 74%.
Ayun. Okay.
Teka, before we go to that, Raymond, so we're gonna ask Doc Nina. So what do we want it to be? What should be the coverage? Di ba we're targeting something?
Kung maaari lahat, Doc Susie. Kasi yung mayroon tayong tinatawag ngayon, hindi na herd immunity. Immunity wall na, brick wall, na ang lahat sana na pwede, na eligible, ay magkaroon ng bakuna. Kasi nga, hindi natin alam kailan dadating mag-emerge na naman variant and so on. We want that solid barrier to the virus sana. Hopefully 100%, actually yun pero baka mahirap. Then we can lower it, pero we have to aim higher.
Okay. Raymond, go ahead.
Okay, thank you. So, very important po, no? Kasi mapapansin nyo po, if you remember the table of Dinina, the A2 population and then the A3, yung pong pediatric, yung po yung talagang mabababa po talaga na kailangan pong i-target po na. And that's why we have been having the National Vaccination Days. Part 4 na ngayon. Today po yata ang last day of that, part 4. For the second question, we'll be posing it to Director Shelley. Ang katanungan po is, ano ang ibig sabihin ng term na healthy aging? Ano po ba, Ma'am Shelley?
Yan. Kaya pang gawin ang mahalaga sa kanila. Yun ang tamang sagot dyan. Functionality, functional well-being.
Ayun. Thank you so much. So, ano po siya? It's at least in Zoom, 57% of those who participated chose that as their top answer po. Although there were still others who chose the other questions. I think we'll be moving on to the final messages po of our panelists. Unless you still need a bit more time. If you need okay po.
Okay na.
Mag-close na tayo.
Okay.
Sige. So, ako na ba magsasalita?
Go ahead, Shelley.
Go ahead, ma'am.
Yes, older persons may safely go out in level 1 areas, whether they're frail, pre-frail, or especially if they're robust. But it's safest for them to go out as soon as they have completed their vaccination and booster doses, di ba? And we need to make sure that we are able to sustain functional ability or healthy aging during this pandemic. Let's not lose focus. Ang gusto natin talaga is to do things that are meaningful to us. Diba? Bakit pa tayo magpapabakuna? Diba? And in order for us to achieve that, we have to have a good health system. And the community needs to be supportive. Social support, protection from ageism, continue to learn, and we go out because we want to walk out and be active. So let's also have some enabling technologies and a good environment in order for our senior citizens to do all the things that are meaningful to them. Thank you.
Okay, thank you very much. Dr. Alvin.
Yes, we have to keep ourselves vigilant and keep ourselves updated and follow minimum protocols so that we try to update ourselves regularly so that we make informed decisions. Thank you.
Okay. Yeah, thank you very much. Dr. Poblete. Doc Ed.
Okay.
Go ahead, sir. Go ahead.
For seniors to be able to go out freely, we have to trust our healthcare systems as well as our healthcare workers. I believe that we are trying the utmost. We have the utmost care for our patients, and we won't put any one of them in harm, albeit we will be working towards a healthy aging system in the long run. So, sana po magtiwala tayo na mas lubos sa kanila. Thank you.
Thank you very much, Dr. Poblete. Let's go to Ma'am Nina.
Oo, syempre gagawin naman ng ating ibang mga panelists lahat nung alam nilang gawin, no? More taking care of the elderly. Ako dahil nasa vaccine, pabakuna po yung mga hindi pa nabibigyan kahit isang dose. At kung nagkaroon ng isa, tapos medyo matagal, pwede pa pong ihabol para ma-fully vaccinate kayo and get a third dose. Yung iba po magkakaroon na ng second dose, second booster or fourth dose. So, tignan natin, no? Mas makakalabas kayo. Mas magiging free kayo and mobile. Oo. Yun lang po. Salamat.
Thank you very much, Nina Gloriani. Okay, so we are now going to go into our evaluation.
Yes, okay.
Yeah, go ahead.
Thank you, Dr. Susie. So we still have, a little over 1,000 participants in the Zoom. So ulitin ko lang po, wala po kami inilalabas na hiwalay na evaluation poll. Ito lang po talaga yung evaluation poll namin. And this is a 4-point Likert scale na for 5 questions that we have. And for these 5 questions, these are as follows. The panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language with technical medical jargons adequately explained. And number 5, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. So, strongly agree po yung sa taas ha, so strongly disagree po yung nasa baba. Yung iba po kasi minsan daw po nalilito. We will not be closing our evaluation poll. We are seeing that marami pa rin po ang sumasagot as Dr. Susie introduces our synthesis and closing remarks speaker.
Okay, for our closing remarks today, we have our Deputy Director for the Philippine General Hospital, Deputy Director for Health Operations, Dr. Stella Marie Jose. Stella.
Hello, everyone. This is a very enlightening webinar, as usual, and all our speakers are experts in their field. To summarize, Dr. Shelley de la Vega reviewed the COVID-19 risk and morbidities for Filipino older people, and she said that mortality is increased in 50 years old and above patients. She also mentioned the special COVID population, that the patients had dementia, and the spectrum of our elderly population. We have the robust, the frail, and the frail. And she emphasized the functional ability, which is the intrinsic capacity of a person and sustained by environmental support. She said that the healthy body through vaccination is very important, and she cited 3 patients of hers who had the questions on vaccination. And vaccinating the vulnerable, like the elderly, is an absolute priority. So, yung mga elderly ho, dyan sa ating audience, makinig po tayo kay Dr. Shelley because it is a very sensible recommendation. Sabi niya, kung pwede nga daw, dapat yung barangay mag-house to house para mag-vaccinate. That was also mentioned by Dr. Poblete. She also emphasized na merong manual geriatric training for primary health service providers, and dapat siguro tignan natin to, basahin natin tong manual na ito. Minention din niya yung about digital connectivity of senior citizens. Ayan, nakaka-stimulate ng neurons, so para makatulong ho yan sa ating senior citizens, no? And 83% now mostly use the cell phone, 58% the laptop, and 37% the desktop in a study in UP Los Baños and UP Diliman. Ang kanyang parting words in how to prevent dementia is number 1, minimize diabetes mellitus, treat hypertension, and minimize obesity. So, dapat lahat tayo mag-take ng ating BMI, ating body mass index, at sana tayong lahat ay nandun sa normal range. And she said that to achieve healthy aging, do this to achieve healthy aging and quality of life. Sa talk po ni Dr. Professor Nina Gloriani, she mentioned yung topic natin talaga, yung pwede bang lumabas ang mga senior citizen. Ang sabi niya, you have to ask this question, how safe is it? So you have to do risk assessment. No? Tanungin din yung vaccination level of the senior citizen. Are they fully vaccinated or unvaccinated? In the census of the Department of Health, sa mga senior citizens, ang fully vaccinated lang ay 74%. At ang unvaccinated ay 36%. So madami pa rin unvaccinated. For the unvaccinated, are they at risk? Ang sagot po ay yes, they are at risk. Kahit po hindi sila lumalabas, they are at risk because family members are the ones who go out. No? So the unvaccinated who get COVID, they shed more virus and for a longer period of time. So, minention yung Omicron subvariant, yung original and other covariants are more transmissible. They cause severe disease and they evade the vaccine-induced immunity. So, take that into consideration. So the considerations for senior citizens to be out are number one, the vaccination status. Number two, the risk assessment and the vulnerability. And you scan the environment and the activities to engage in, ano ba ang pwede nilang gawing activities, and you have to wear the protective gear or the PPE. So, dapat improve natin ang ating national vaccination coverage per individual. So, the importance of vaccination is, it is a protection for the elderly. The boosters are added protection, so hindi tayo dapat maging complacent doon sa primary series lang. At ngayon, magkakaroon pa daw ng third dose. No? Pagkatapos ng primary and booster, magkakaroon pa tayo ng another booster dose. 9.7 million Filipinos received the booster dose, so mababa pa rin po. Additional booster dose, you have retained protection against the Omicron, especially the BA.2. And we have to wear fitted masks. And so the last speaker, Dr. Ed Poblete, who's the president of the Philippine College of Geriatric Medicine, emphasized that yung about vaccine hesitancy. So nakita nila na the higher educated persons, they are less hesitant. Siguro dahil nga na-enlighten ang mind sila sa lahat ng mga webinars at saka mga symposiums about this. Yung environmental factor daw, so yung mga in the indigent population, they are less likely to be vaccinated. Age is a factor, and nag-i-increase ang vaccine hesitancy, and the socio-economic status also. So the higher the socio-economic status, and surprisingly, the more vaccine hesitant sila. So, ang suggestion ni Dr. Ed Poblete is target vaccination and good education, increase access, more services for vaccination. At sabi niya, nire-recommend niya magkaroon ng senior citizen lane. So, magkaroon tayo ng vaccination days only for senior citizens. And so, with this one, we hope to improve our vaccination statistics. Over to you, Susie.
Okay, thank you so much, Stella, for that excellent summary. We're so fortunate to have Stella with us today to do that summary. Maraming salamat, no? Okay, so our discussion, we'd like to thank all our panelists for the time that you spent with us. You can see in the chat, our audience really appreciates very much your insights, sharing information, and the personal experiences that you have shared with us. Maraming salamat po. Next week, okay. Okay, so we talked about Gera. I remember, pinag-usapan natin yung Gera tsaka pandemya, no? And true enough, we're actually seeing increasing COVID in other parts of the world, but that's not what we're going to talk about. We are going to talk about something that is not talked about very much, but we think all health workers could benefit from learning more about chemical weapons, nuclear attacks, biological weapons, radiation. No, hindi natin masyadong pinag-aaralan yan, hindi natin inaalam kasi wala namang need, no? Pero ngayon, I'm sure many of you are following what's happening in Ukraine. And itong girian, no, between Russia and the Western countries, but an actual war in Ukraine where actually some banned weapons are being used. Merong mga ginagawa yung mga Russian na kontra talaga sa sa international law, no. So to prepare us so that we have more information, we are going to talk about how prepared are we for for what should I say? How do you call it? This chemical, biological, nuclear weapons. How prepared are we for that? just in case, right? So we are far away from Ukraine, ando na tayo. But we are not far away from North Korea or from China or from some other countries where there could be conflict. So we are going to devote the next episode to talking about these new kinds of public health emergencies. We're going to have experts from the Philippine General Hospital who will be talking about what we call CBRNE, chemical, biological, radiation, and nuclear events, and what we should know. No, what should we know? Alam niyo I was in Japan for a while, di ba? I was in Japan for 3 years. Yung mga bata doon, may drill yan eh. For air raid. Kunyari, merong threat ng nuclear weapon. They know what they're going to do. No, meron silang mga nilalagay sa ulo, pupunta sila sa ilalim ng mesa, nakadikit yung kamay nilang ganon. Kasi nadaanan na nila yon. Now, I'm not saying that that's going to happen to us, okay? But what I am saying is that because it's being discussed, we should know as frontline health workers what this means and what we should know, and we should know more than what other people know. So we are going to talk about that next week. Abangan nyo, very, very exciting discussion po yan. Okay, Raymond, over to you.
Thank you, Dr. Susie. Hindi lang po nasabi ni Dr. Susie, pero matutuwa po kayo sa aming inimbitahan at sana po ay makasama po siya at least for our webinar for next week. Really, that at least in our opinion, the top expert in this area po who will be discussing everything that's in relation to CBRN events po. We are seeing on the screen po the results of our evaluation poll. We are happy to note that wala na po siyang problema with regards to the evaluation. 685 or 69% of the participants were able to put in their answers po, and at least on average po, no, 85% of those 85 to 86% answered strongly agree sa ating questions for the evaluation poll. So maraming salamat po. Before we conclude our program, we would like to acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we won't be able to churn out our quality content for our growing credible online community po. So maraming salamat po sa lahat. And finally, all Stop COVID Deaths webinars are archived for viewing if you go to www.youtube.com/TVUPPH. I saw at least in the chat one question, paano daw po niya mapapanood po ulit ito dahil medyo intermittent ang kanyang signal. After this webinar, kasama po ng 91 webinars before it, maisasama po siya dito sa TVUP YouTube channel. So, punta lang po kayo sa YouTube, go to TVUP and you'll be able to see today's webinar archive there. So, this formally closes our webinar for this week. Sana po marami po kayong natutunan. Something that could also be helpful and relatable. Sana po ma-share nyo rin po ang webinar pong ito sa inyong mga elderly or senior citizens po na kaibigan, kamag-anak, maybe magulang o lolo-lola po ninyo o katrabaho. Makakatulong po ito para mas malinawan po sila tukol po sa pagbabakuna at ano po ba yung kailangan po nilang gawin, lalo na po na nag-alert level 1 na po sa maraming mga lugar. We look forward to your company next week, which is Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy. See you online!
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on come to pass, 'cause His salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others loves before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will hold the line.